Thank you, Chairwoman Eshoo. Today, we continue this committee's work of combating the ongoing drug overdose crisis. This crisis is a tragedy, taking more than 100,000 Americans far too soon during the first 12 months of the COVID-19 pandemic. For years, we've worked to combat this crisis. Earlier this year, as part of the American Rescue Plan, we included $3 billion in funding for the mental health and substance use block grant programs at the Substance Abuse and Mental Health Services Administration. And this funding was the largest aggregate amount of funding for these programs, and it goes to critical programs and services for people experiencing substance use disorder. The American Rescue Plan builds upon the work we've done, but we obviously must do more. Today, we're once again discussing solutions to the overdose issue and what more Congress can do to end this crisis. Synthetic opioids such as fentanyl and fentanyl analogs have been a significant driver of overdose deaths in the United States. Last year, the Centers for Disease Control and Prevention estimated that more than half of overdose deaths involving synthetic opioids and drugs mixed with synthetic opioids, primarily illicit fentanyl. Availability of illicit fentanyl in the United States has dramatically increased, and manufacturers have been able to evade regulations by rapidly manufacturing new versions of fentanyl substances that aren't subject to control. Today, fentanyl-related substances are temporarily placed in Schedule I of the Controlled Substances Act, which is the strictest category of regulation. Schedule I is reserved for drugs that have no accepted medical use, a high potential for abuse, or lack of accepted safety. Schedule I also prohibits the manufacturing, distribution, or dispensing of these substances unless given explicit approval to do so. The current temporary scheduling order subjecting fentanyl-related substances to these strict restrictions is set to expire on January 28th of 2022. However, the CR we will consider this week, and probably today, will provide for an extension through February 18th of next year. And it's critical that Congress and this committee work together in a bipartisan fashion with the administration to put in place a long-term solution. In September, the Biden administration released recommendations to address illicit fentanyl-related substances prepared by the Office of National Drug Control Policy, the Department of Health and Human Services, and the Department of Justice, and I appreciate the witnesses for joining us today. The administration's proposal would create a class-wide definition of fentanyl-related substances and permanently place them in Schedule I. It would also create a mechanism to expedite rescheduling or descheduling of substances as needed. And I'm pleased that the proposal also includes provisions to streamline registration requirements for all Schedule I substances, aligning Schedule I registration requirements more closely with Schedule II requirements will help expedite registration for researchers who want to study Schedule I substances and will hopefully help to expand further research in this space and development of future treatments. I look forward to learning more about the details of the administration's proposal and why Congress should pass legislation to reflect the recommendations. As we discuss this proposal, it's also important we remember that this is a set of recommendations. This committee is responsible for crafting the actual legislation that will help dramatically improve the lives of many Americans. There are many ideas and proposals to meet this goal, including strategies that strengthen prevention, treatment, harm reduction, and recovery services. There is no idea too big or too small to get ahead of this crisis, and we must work together to solve it. And finally, I wanted to say that I am pleased that DEA is represented here by its Principal Deputy Administrator, and I look forward to also working directly with DOJ on the administration's proposal so this committee can better understand the intent and rationale behind their policy recommendations related to enforcement. So look forward to hearing from all our witnesses. And Madam Chair, I know that this is something that you're very concerned about and have been for some time, and thank you for having this important hearing today. I yield back.